بسم الله الرحمن الرحيم.
Thank you for calling One Home. If this is a medical emergency, please hang up and dial 911. Para español, oprima el 8. Pour créole, tapri, is set. Please listen carefully as our menu options have changed. Calls may be recorded or monitored for quality assurance and training purposes. If you know your party's extension, you may dial it at any time. To use our dial by name directory, press 9 or choose from the following options. For Humana Health Plan patient-related inquiries, please press 1. For Care Plus, please press 2. For all other health plan patient inquiries, please press 3. For billing, please press 4. For TPA, please press 5. For all other calls, press 0 or simply stay on the line and we will assist you shortly. To repeat this menu, press star.
Good morning. Thank you for calling One Home. Keep in mind this call is being recorded and monitored for quality and training purposes. My name is Alexander. How may I help today?
I need to speak to a supervisor.
Any particular reason?
It's really complicated. It's necessary for me to speak to a supervisor.
Okay. May I have your first and last name?
Omar Mohsen Ibrahim Fuad.
Omar Marson. Okay. Let me see. And what's your date of birth?
December 14th, 1988.
Okay. What's your last name again? Sorry.
Fouad.
Okay. May you confirm your full address too?
I need to speak to a supervisor, sir.
Okay, sure. Let me get in contact with the supervisor for you. Just a minute. Omar,
Yes.
I got Helen, supervisor in charge. She's on the other line. She will be speaking with you. I thank you for calling One Home, and you have a wonderful day, sir.
Mm-hmm.
Hello, good morning. Thank you so much for calling in. Hi, my name is Helen. I'm a supervisor here at One Home. Am I speaking to Omar?
Yes.
Hi, Omar. Thank you for calling in. How may I assist you today?
I need help at my house as soon as possible, please.
Okay. Are you referring to home health?
Yes.
Okay. Well, yeah, thank you for calling in. I'm looking at your account, right? I did see that a doctor attempted to order home health services. However, may I ask, do you have Blue Cross Blue Shield as your insurance?
No.
Okay, you don't? Okay, allow me one moment. Let me go ahead and just verify eligibility because it looks like we couldn't provide services, at least on the most recent order from June 26th, and we alerted the doctor that it shows that you have Blue Cross Blue Shield. Let me see if anything has changed. Let me go ahead and look into that now. Allow me one moment. I'm just looking up the information. It's taking a minute. Maybe logged out of my account for the insurance. Check something. Just letting them still here. Just trying to get into my ability account. In question, have you had, all right, so may I confirm, what insurance do you have right now?
Humana.
You have Humana. Do you know when you switched to that insurance, or if you had Humana all along?
I've had Humana all along. I considered changing to Florida Blue because I saw an advertisement that had that mentioned a health benefit spending card if I transferred to them, but it turned out to be a scam.
Oh, I'm so sorry to hear that, sir. Okay, understood. Understood. Just trying to get into my spam folder. I haven't been able to log into my account to verify insurance. But what I'll do is, even if I can't get into that, our intake coordinators, they're the ones that notated that they were unable to process the order because when they checked insurance, it showed Blue Cross Blue Shield. So what I'll do is I'll send this over to that department supervisor for that to be investigated and for a follow-up to be made. Would that work for you?
I need to speak with you directly because it's getting confused too much. Do you mind if I call Humana on three-way so you could verify with me on the phone, please?
Now, I can say, unfortunately, I can't say on why you contact the insurance. However, I'm a supervisor for call center, and it's mostly when it comes to durable medical equipment. Intake supervisor may be the best team to do this with because they're the ones, when they get an order, they verify eligibility. So I think it may be best to possibly see if we can do a three-way with our intake supervisor. Unfortunately, yes, I am a supervisor, but it's mainly call center, durable medical equipment. We're kind of separated in the department. So even if Humana got on the phone and said, hey, the patient has Humana insurance, they won't be able to use my word alone. But I will go ahead and send this over for this to be investigated.
Could I speak with the supervisor right now?
Now, intake, I have to email them for a follow-up because they don't have a live line for me to call right now. But I will go ahead and request it to be escalated and reviewed.
Yeah, I need to speak with someone right now.
And I absolutely hear you with that. But they don't have a live line. And wait, let me check one more thing, because you know how I was saying I was having a hard time getting into the site where we verify insurance. I just now got the code, so allow me one moment. I may be able to see it for myself. And if I do see that it shows as Humana as the primary, then I'll go ahead and screenshot it and send it to that supervisor. I apologize, that was taking a while to load for me. Okay, I should be able to access this fairly soon. Okay, I'm logging in now. Okay, I'm on the site, looking up your insurance as we speak. Okay, taking your member ID. And your date of birth. Okay, let's see the pulled up for me. Okay, let's see. So I am on your insurance tab. It does show Humana as the payer. And as of right now, I'm not seeing anything regarding Blue Cross Blue Shield. So I'm going to screenshot this. I'm going to send it to intake supervisor. Unfortunately, they don't have a live agent on the phone for me to speak to. But I will go ahead and request a follow-up to be made and for this to be investigated. Now, home health orders, they tend to last for about 7 days, right? So I'll notate that the reason why it wasn't processed was due to our coordinators notating that your insurance was showing as Blue Cross Blue Shield as the primary and seeing what they can go ahead and do with that. I'll also request if they can go ahead and reprocess it and work that for your case to be escalated so you can get services as soon as possible.
Okay, yeah, because today is July 15th.
Yes, sir.
So when are they going to help me at my house?
So I can't give you an ETA because this is an escalation that needs to be investigated and followed up with. So I can't give you a time estimate because they're going to have their supervisor use their resources to see what can be done regarding this order. But I'll bring it to their attention. And just to be safe, let me go ahead and verify the best contact number for you.
772 538 8586.
8586. Okay, perfect. So I'll ask for them to go ahead and follow up, for intake supervisor to follow up regarding this. And once, if they're able to use what they have to go ahead and process, then they can advise. If they end up needing a new order, they'll be able to advise so there can be some progress on your case. But I'm putting this in. I'm stating that, hey, urgent assistance is needed. The patient needed home health. Back when this was previously ordered, at the time, our coordinators notated that the insurance was showing as Blue Cross Blue Shield. However, when I checked the availability site, which verifies your insurance, it looks like Humana to me. Is there anything else I may assist you with, Mr. Omar?
What do I do now?
So you would need to go ahead and wait for that call back. I still do recommend following up with the insurance too to see if they have any resources to help this be expedited. But internally, I'm asking for our teams to review expedited and go ahead and contact you with an update as soon as possible.
Okay, could you hold it for a second so I could call them so we could tell them that?
Now, unfortunately, you know how I mentioned earlier, I can't stay on while you're dialing out to the insurance. You will have to go ahead and call them directly.
What do I tell them again?
You'll tell them that your doctor ordered home health. Our coordinators, when they reviewed the order for home health, they saw that your insurance was showing us Blue Cross Blue Shields, and they said that we couldn't be the providers. But now, fast forward to today, I'm seeing on the insurance site that it is, in fact, Humana. Basically stating that you needed home health a long time ago.
Could you please just tell them that for me so they could see that it's urgent? It'll only take a minute.
Of course, I completely get you, but I'm telling our internal teams about the urgency just because I can't really I can't really push their hand on it. I can't make the change for them. I can communicate with our corresponding departments.
Yeah, it's just, I know if I call them on three-way, it'll only take a minute. If I call them on three-way on a conference call, they'll be able to put the notes in the system also, and they'll document the urgency and the fact that I called the supervisor, and the supervisor acknowledged this also.
Okay, you can go ahead and dial out.
Okay, 1 second, please.
If you are calling about press 1. All other callers, please press 2.
Humana Medicare. Calls may be recorded for quality assurance. Whenever you're ready, just describe why you're calling today. For example, reset my online password, or how much does a flu shot cost?
I need to speak to a supervisor.
Okay, just to make sure, you're calling as a member, right?
Yes.
To get started, what's the date of birth of the person you're calling about?
December 14th, 1988.
Sorry, what's the date of birth?
December 14th, 1988.
Thank you. Which policy are you calling about? Medical, pharmacy, or Go 365?
Medical.
And one last thing. Once you're done speaking with a representative, if selected, would you like to take a survey to provide feedback about your experience?
No.
All right. Information provided is subject to the limitations, terms, and conditions of your plan. One moment, please.
Thank you so much for calling Humana. My name is Stephanie. How can I assist you today?
I need to speak to a supervisor.
Okay. Do you mind telling me who I'm talking to?
My name is Omar Mohsen Ibrahim Fuad. My Humana member ID number is H08403701.
And then you mind telling me your zip code? Because they got two profiles up here, so.
32303.
Okay, I see that one. Hold on. And then they are going to ask me for your phone number when I reach out to the supervisor. It's still that 772-538-8586, right?
Yes.
Okay. And you got anything specific that you want me to tell them you calling about, or you just want to speak to them?
It's really complicated. It's necessary for me to speak to a supervisor.
I got you. No problem. I'm getting their phone number right now, so you hold on for me, okay? Give me 1 second. Supervisor right here. I don't know what it's about exactly. I'll be right back. One moment, Omar. Hey, just pop in on to let you know I'm still here. I've just been typing an email. Okay, Omar,
Yes.
I have a supervisor on the line by the name of Jeremy. He's going to talk to you from here. You have a good day.
Mm-hmm.
Hello, Mr. Omar. How are you doing today?
Not good.
No, I'm sorry to hear that. How can I help you?
I have a supervisor on the phone from One Home Solutions. I need help at my house as soon as possible. She's on the phone with us now. Ma'am, are you
Yes, sir.
Yes. We're trying to resolve the situation so I could get help at my house as soon as possible. They mentioned
Hey, what situation are you trying to resolve?
I need help at my house as soon as possible.
Okay, so you're just trying to get some home health?
Yes.
Okay,
Yes,
that's the reason you wanted to speak with the supervisor?
Yes.
Okay.
And my apologies for interjecting. The sound, there's been a little bit of delay on my end. But yes, thank you, Jeremy, for taking our call. My name is Helen. I'm an escalation supervisor at One Home. I'm reaching out, and I can explain the situation on my end. I don't know if you may need some time to pull the account.
I have his information up, Helen.
Okay, thank you so much, Jeremy. So I'll go ahead and explain it. So back on 6/26/2024, we got an order for the patient to get home health. Now, the escalation is with our internal intake team. It looks like our intake team took that order and they notated that the patient's primary insurance is Blue Cross Blue Shield and that we aren't the providers. But when I take a look at the patient's insurance, it's obviously showing as Humana. So I did inform Omar that I will go ahead and escalate it to our intake supervisor regarding this, because that means the patient didn't get care. And as long as the patient had Humana at the time of receiving the order, I'm escalating it to their supervisor to review, investigate, process and hopefully provide the member services as soon as possible. But the member did want to go ahead and just alert the health plan regarding this escalation because he didn't get home health services.
Okay. And was it the Blue Cross or Blue Shield that stopped him from getting the home services?
Yes, sir.
Okay, yep. I see we did our research on that last week. And on Friday, we were able to reach out to Blue Cross Blue Shield and complete the investigation. So let's see, it shows that it ended on June 10th of this year. So definitely, if we still have that order for the home health, or if you guys can send it back to us, you shouldn't have any issues with the COB of these two insurance.
I'm so happy to hear that. Well, yes, I'm finishing up my email to our intake team supervisor. Now, what I can say is these orders tend to expire after 7 days. But so there may be a chance that at some point they may request a new order, or they may be able to work with what they already have. But yes, internally, I'll go ahead and request for them to review, process, do anything they can to help the patient get the home health services that were originally requested.
Okay.
And can I confirm something? You said that
Sure.
Blue Cross Blue Shield stopped by June 10th, right? So by June 10th, he was back on Humana, right?
Yes, Humana was primary after the 10th.
Okay. Because that was on June 26th where we got the second order. So I'll make sure to notate it so that their supervisor is aware.
Mm-hmm. All right. Now, was there anything else I can help you guys with this morning?
I don't know. Could you please tell them that it's urgent?
Yes, I'm notating the account now as we speak. All right, perfect. All right, Mr. Omar. Now, was there anything else I could help you with this morning? Sorry?
I don't know. To be honest with you, I really need help as soon as possible.
Okay, yep, I definitely do understand that, and to have this other insurance stop a lot of things. But I'm glad that we got this taken care of, so that way when Helen's team sends over that request, we can go ahead and work that as soon as we get it, and we won't have that other insurance to stop us.
And Helen, does it say what the order was for? What services exactly?
Yeah, let me go ahead and pull that up for you. I'll tell you exactly how it says on the prescription. Okay. It says home health referral stat. It says chronic back and neck pain making completing ADLs at cleaning and hauling trash difficult. Now, it doesn't actually list the services being requested, so that may be an issue other than saying other than saying your diagnosis and the issues you've been experiencing, they have to list the service being requested. So, for example, if it's physical therapy that's needed and home health aid, or nursing, physical therapy, and home health aid, it is the doctor's responsibility to write that on the prescription so that when we do send that to the insurance, they know exactly the services being requested, so there's no room for guessing the services needed. So that is also something important about the order.
So
Okay.
So what do I have to do now?
The doctor, I recommend, now I'm still going to do the same thing I said I was going to do before. I'm still going to send this over to our intake coordinators and ask for them to work with this order. However, I think it is important that the doctor sends an order, like writing exactly what services they're requesting. So if you need nursing, they'll have to put nursing on the order to need physical therapy, they'll have to put the words like physical therapy on the order. So any services you're needing, they actually do have to list it out.
And what did they write again?
Yeah, they basically wrote what's causing you to need home health. They wrote that, let's see, it says chronic, so it says your diagnosis is chronic low back pain. It says chronic back and neck pain making completing ADL, like cleaning and hauling trash, difficult. So if they're needing you to get nursing and physical therapy, they'll have to put that on the order. There is one thing to know about the cleaning and hauling trash difficulty. If the only service that's needed is something that's such as like home health aid, then that's one of the services that can't be like the only services. There has to be skilled care involved. But basically what I'm saying is if the doctor's office wants you to have nursing TT in home health aid, they'll just have to put that on the prescription and send that to us, because we're also going to send that to the health plan. And although Mr. Jeremy said that they'll go ahead and work with the order, I don't think that they were aware that it doesn't list the exact services being requested on it.
So I don't understand. So they're not going to help me?
It's not that they're not going to help you. It's that the doctor, when they're requesting home health services, they have to write on the order the services that they're requesting.
Jeremy, what do I do?
I'm sorry, what was that?
What do I do?
As far as what?
Helen was saying something that they didn't write something.
They didn't write out the services on the request?
I don't know that she says.
That's correct.
Yes, that's what I heard. Okay, so
condition.
So what you need to do is make sure that your doctor who sends in the request lists out those services so that we'll have a clear understanding of what you're requesting.
So he wrote that I'm having difficulties with cleaning and throwing out the trash. Is that not enough information?
Well, we won't know until that department reads the request. The reason they didn't do it last time is because we're secondary. Now that issue has been resolved, we'll need to send the request back in so that they can review it, and then they'll make a determination on if they'll approve it or deny it.
So, Mr. Omar, does that give you a little bit of a better understanding? For me to try my best to state it clearly, I recommend that the doctor sends an order with the name of the service being requested. Unfortunately, just a description may not be able to work because our orders require the state what's being requested. However, once again, I'm sending this over for our intake team to review to see what they can do with the order that they currently have, and now that the whole insurance thing in the switch has been resolved. So if you were asking what's left to do or what's next to do, for the order that's currently there, you can hold off and wait for a follow-up by our intake supervisor. But if you wanted like an action item to do, you can alert your doctor's office that whichever services they're requesting, they have to put the title, because we have different, for example, our home health agency, they have nurses, they have physical therapists, they have occupational therapists, they have home health aid. The problem with the portion that I'm talking about is they didn't outright write the services being requested. They didn't write that you needed physical therapy. They just let us know that you have chronic back pain, back and neck pain, and you have a hard time cleaning and hauling trash. that kind of clear things up for you?
I don't know. I still need help. I haven't gotten help at my house. That's the thing. And every time, it's always a different problem. Every time I try to get help, I'm just at this point. I feel like I'm gonna die because of this.
Oh my gosh, I'm so sorry. No, I truly am sorry to hear that. I recognize you're at home, you're needing help. I also recommend, so between all of this, once again, I'll still do my part by sending this information over. But also, if you feel like your life is in jeopardy, please seek emergency services.
Yeah, I did.
And once again, I do apologize. Yes, we went ahead and went over the things that, have to be done. I'm sorry. There are a lot of stipulations when it comes to ordering services, home health, making sure the insurance is good, and so on. There are a lot of steps when it comes to that. But I'm doing something on my end internally by sending this over to the coordinators. So my best recommendation is if you can contact the doctor and let them know, hey, an order may be needed. I'll ask our intake coordinators to also follow up if they feel like they can't work with what we already have. But in the interim, if you feel like your life is in jeopardy, please seek emergency services. Again, I'm so sorry to tell you that. Nobody likes to hear that. But it's absolutely worth it if you feel like you're being put at risk due to this and not having home health services.
Yes, I understand. I recently had to go to the emergency room because of this, and I was there for several days, and I told them the exact same thing, and they prescribed me some steroids and pain medications. But also, I feel sick now, and they had to prescribe me an antibiotic, and I have a doctor's appointment today at Dynamic Pain and Wellness in Tallahassee, Florida.
Okay.
But I'm gonna have to reschedule because I don't feel good.
I'm absolutely sorry, sir. Thank you for explaining that. I can get how frustrating it is because it sounds like you did go ahead and go to the hospital and you needed assistance, but it sounds like they prescribed you some medication that just isn't making you feel well at all. So I absolutely apologize. But unfortunately, these are the steps that we have to take. But do you may have any other questions or concerns?
Yeah, Jeremy, is the home health aid services covered by my insurance?
Let me take a look and see. So, yep, it is covered under your benefits.
What does it cover exactly?
Up to 4 visits per day is for pregnant members or members under the age of 21, or you can get 3 visits per day for anyone over the age of 21. So it includes home health visits, skilled nursing visits. It includes housekeeping, escort services, nursing assessments, professional development training, yard work, gardening, home maintenance work. It includes a lot of things. So from what we've discussed on the phone, everything that you're asking is included with your plan. But you only get 3 visits per day for the home health.
Could you name all of them? Could you name all the rest?
The ones I just said?
Yeah. Were there any other services that they cover?
What type of services? I named all the ones that it's covered.
Oh, And I'm so sorry to interrupt. You know how I did advise earlier that I couldn't really stay on the phone while you contact the insurance? I do have to go now, but thank you for taking the time with me to work with me to better understand Mr. Omar's case. Now, unfortunately, I do have to go. I'll still do my part and send that information over. But thank you so much, Mr. Jeremy and Mr. Omar, for speaking with me regarding this escalation.
You're welcome,
I hope you
Helen.
guys have a wonderful day and
Helen,
stay safe.
Helen, before I let you go, I'm trying to just make sure that you're able to acknowledge this. Jeremy, what's the insurance and policy number so she could confirm it?
Your member ID number?
Yeah. And I have it. I use it to communicate with other departments. I took a screenshot of it to show that you have Humana insurance right now and actively.
And what's the full name of the insurance?
The name of the insurance?
Yes.
Humana Healthy Horizons.
Is that a Medicaid or a Medicare or Go 365 or?
It's Medicaid. Florida Medicaid.
And then, Helen, you accept Humana Medicaid?
From I understand now, my resources can sometimes be limited because it's our intake team who actually verify insurance eligibility. I can see that's Humana and it says Humana Medical Plan, but I may not have access to the same resources because it's our intake team that actually take these orders and verify the plan, the insurance, and so on. So the only reason why I can't verify that myself, other than what I see in a system that shows as Humana Medical Plan, our intake team should be able to do, and that's why I'm also requesting for them to contact you back directly. And I'm so sorry to add on, when you were mentioning verifying the home health services that the insurance covers, I know that Jeremy mentioned the home health aid, and I believe he said 3 visits a day that are covered. But there is something important that I was telling you earlier regarding this. Home health aid is considered unskilled care. Sometimes it can include things like cleaning, maybe sometimes cooking, services like that, right? But that can't be the only service. And then our agency, it's how the services are set up is once we get the order, the approvals and everything, we send a nurse out to evaluate you. That nurse creates a plan of care. Now, I cannot guarantee that that nurse can come out multiple times a day. We tend to do visits because we're a short-term agency. Any type of ongoing care assistance, those are some things that we're just not contracted to provide. However, he did list out the services. We provide things like nursing, physical therapy, occupational therapy, home health aid. So I'm not saying that those are services that you can't get. I just can't guarantee that when it goes through all of the department's processing that you could expect to receive a nurse multiple times a day, depending on the services being requested from the doctor.
So I don't understand what Jeremy is Humana Medical Plan the same thing as Humana Medicaid?
Yes.
Because they told me I need to call One Home Solutions, or they need to send a referral to One Home Solutions because that's who Humana Medicaid is contracted with for home health aid.
And that's us. Mm-hmm.
Yes.
So, I mean, I told my doctor's office all of this, and they're supposed to know what to do, right?
Yep, they will know what to do. They should be the ones sending the referral to Helen's company.
And Helen, they sent the referral, right?
Mm-hmm. Yeah, I'll tell you where it says the doctor that sent this order. Loading for me again. My apologies. It says that this came from FSU Primary Health, and then it says the doctor or at least the doctor that signed the order, George Windon, MD.
Dr. George Whidden. Yeah.
Mm-hmm. So, yeah, they sent the referral. It just wasn't complete. And then at the time, the reason why it got turned back is due to the whole Blue Cross Blue Shield thing. I also noticed something else, too. You know how earlier in the call I was trying to verify insurance for you so that I can, if I saw that it shows that the patient actively has Humana, I can screenshot that and send that to them. Well, I also noticed recently that it shows that the Humana plan, at least on our end in Availity, it shows that began July 1st. If that's the case, then that may mean that Blue Cross Blue Shield or the Humana may have not been active until July 1st, and that order was sent in June. That's a possibility, but Humana did go ahead and clarify, and I went ahead and included that in my email to their supervisor. Just to let you know, I've already sent the email for the follow-up as well.
So there's nothing I need to do right now at this point?
As of right now, I don't think there's anything for you to do other than letting the doctor know that the order that they sent over, it didn't include the services. But in the interim, there'll still be things working in the background because I still sent this information over to our coordinators.
So they're not able to acknowledge that the doctor said I'm having difficulties cleaning and throwing out my trash?
I'm not quite sure. It kind of depends on when the intake supervisor reviews it, because I went ahead and listed details regarding it. But, yeah, most orders, they do require more than just the reason for services. It requires the doctor to clearly state the service that you need at home. And I know that it's one of those things where you're like, okay, why can't they figure it out from the description? But it's because things have to, clearly state it in the paperwork.
So they're not going to help me?
I'm not quite sure, but that's why I sent the information over, though, so that if they can work with it, then great. If they can't work with it, then, yeah, your doctor will still need to send an order clearly stating the services that they need for you to have, whether it be nursing. You know what I mean?
So is the cleaning services and helping me around my house, is that not covered?
It can be covered depending. So there's a couple of things that depend on if they can do that. One is the cleaning service can't be the only service requested. When I mention skilled care and unskilled care, the cleaning service is not exactly skilled care, which is something that's required also and you can back me up on this, Jeremy. You guys also require skilled care, right? Home health aid is not a service that can only be provided by itself, right?
Yes.
So you may be eligible to get the home health aid, but that can't be the only service because we're a short-term provider, and it has to include something, whether it's nursing or physical therapy, something that requires representatives to be a physical therapist or anybody to be skilled in it medically necessary for the home health aid portion to be an add-on to it. So that can't be the main service. So there has to be a need for you to have, whether it's skilled nursing or physical therapy. It just can't be the only thing.
Yeah. It has to come as a package.
And then I have to change to Humana Medicare to do that?
You shouldn't have to change anything. First off, what we need to do is just get the request in for the services. Then we'll have more information to give you whether it's covered or not covered and what's the next steps after that.
Exactly.
So you said it's not going to be covered because they only have unskilled care on the referral?
Well, we won't know yet until they review the request.
Right. I was kind of telling you that one of those things where okay, hey, don't be surprised. let's say that your doctor does send an updated order. Let's say they only request home health aid. That's what I was saying in that situation from the description of the order. But I'm not saying that nothing, like, I'm not saying that it's not covered right now. We just got to get more clarity.
Mm-hmm.
Yes, sir, Mr. Omar. Once again, I truly appreciate you. I will have to drop off this call, though. I do apologize. But feel free, hey, if you ever need any further updates, you know how you called in today, you spoke to customer service, and you asked for leadership. You can do the same. We can take a further look into your case. Just like how I did today, I'll leave detailed notes on what I did, what we discussed. You did three-way Humana while we were on the line. So I'll leave detailed notes, but for now I do have to go. But please know I did do what I said I would do. I sent that email over to the intake supervisor who's responsible for reviewing these orders.
And what's the supervisor's name there?
So they kind of have different supervisors, so I can't really tell you directly. It depends on who gets the case first, right? So I can't give you that information right now, but I did include your contact number for you to be followed up with.
Okay. Did you tell him we spoke to the supervisor at Humana also?
I let them know that actually you called Jeremy at Humana, and he went ahead and verified the whole issue with the Blue Cross Blue Shield. That he went ahead and verified the information so they know that we're on the phone with Humana. We spoke to Jeremy, who clarified that Blue Cross Blue Shield ended back on June 10th. So, yeah, I did go ahead and notate that. So they know that it's been escalated to the health plan at this point.
Okay. Is there anything I could do for you, Helen?
I just think the best thing is to be the safest. I still think the order from the doctor may be needed, just clarifying exactly what he's requesting. But in the interim, I don't think there's really anything else to be done at this point. And I do apologize. I recognize you need the services as soon as possible.
All right. Jeremy, we're going to let Helen go. And then, if you don't mind, I'm going to call my primary care physician's office on three-way so we could tell them that.
So that we can tell them what exactly?
I apologize. I'm going to go ahead and head now. Once again, thank you. Thank you so
Helen,
much for calling in.
Helen, really quick.
Thank you, Helen.
Thanks for calling One Home.
Helen, what do we tell them exactly?
Oh, you'll just tell them that if they have to write out what's being requested. So if they want you to have nursing, they'll have to put on the order, please provide the patient, skilled nursing. It just depends on what the doctor truly wants. Unfortunately, the description may not be enough. So whichever services the doctor decided you should get, they have to put it on the order and send it over to us.
And what is skilled nursing exactly?
So skilled nursing, they can provide a number of services. Now, I can't really tell you the services your doctor intends on having for you. I can't really guide you on that, but I can say they do things like maybe medication management. They do the evaluation to determine if you're eligible for the other services. They kind of create the plan of care. So doctors tend to write on those orders whenever they need nursing. They tend to write RN, R like Robert, N like Nancy, eval, and treat. And that just means a nurse is coming out to evaluate and treat you.
And what exactly are the services for skilled nursing?
So I can't list out every single service that a nurse may provide. It is the doctor.
Yeah, it's
up to the doctor to decide which service. Right. They have several services. It's up to the doctor to determine which skilled nursing services you need, and then go ahead and write out what's needed, or go ahead and send an order for nursing evaluation and treat. I can list an example. Sometimes patients have wounds and they need wound care. In those cases, they write nursing eval and treat for wound care. Sometimes they'll list the details about the wound. I know this may not apply to you, but that's a general idea. But it is the doctor's responsibility to know exactly what they're requesting as well and to put it on the prescription.
Because I also need help with making my food, and I also need help with showering and cleaning my bathroom.
So, Mr. Omar, these are the things that you would tell your doctor. You would tell him you need these things at home, and then he would decide which services would fit with the things that you need, and then he would send that over.
I understand, and I also need help with my laundry. I have a laundry machine and a dryer here in my house. So are those skilled nursing services?
I wouldn't.
That would be home health.
When it comes, right, like more like home health aid. That's more along that lines. Now, I can say, hey, sometimes the home health aides, they may be limited in what they can do. They may have a baseline of services they can do, but when the nurse comes out to evaluate you, they determine the plan of care. So if anything out of all of the services, those sound like those will fall under a home health aid.
Say that again?
So out of all of the services you described, sounds like they will fall more so under a home health aid.
And is that skilled nursing or unskilled nursing? Or unskilled?
So it's, and I apologize if I confuse you. When I was referring to it, I was saying there's unskilled care and then there's skilled care. Home health aid is considered unskilled care because it doesn't really require a medical professional. It's more so somebody to come in to maybe help you with daily living activities, like maybe cooking or maybe cleaning. Now, those are the ones I refer to as a little bit limited. That can't be the only service you're needing. Any type of continuous or ongoing care, it can't be the only thing, but the doctor can still write out exactly what they're needing on the order, and we'll have our coordinators, assess that, and then as it makes it to the home health agency, which would more than likely be one at home, where is your location? It would be one of our home health agencies, one at home Broward. As it makes it to them, they'll have their nurse actually assess you and create a plan of care for you and send it to the doctor. But I guess, does that answer some of your questions?
I'm in Tallahassee, Florida.
You're in Tallahassee, Florida. Is it a chance that you may have moved since when you previously may have received services? Are you still in Vero Beach? Or 398146. Is that your address still?
No, I'm in Tallahassee, Florida now.
Okay. So when the doctor is sending over the order, they should also include your updated address as well, because we have your previous address on file. Because the last time we provided services was back in 2021.
2021. What address did they provide services?
So they did put the Tallahassee address. However, you know how the order was unable to be processed because of the whole Blue Cross Blue Shield thing. So they do have that on there. And I also I'm screenshotting that as well for our intake coordinators. And I'll respond to it, asking for them to update it. But when the doctor, you know how we were talking about doctor listing out the services requested, as long as they have that address on there as well, and we determine that, hey, it can go through processing this time, then that portion should be fine, because I'm also alerting their supervisor about the address.
Okay, and then you said that the last time that they provided services was at the 398146 place, Vero Beach address?
Mm-hmm. Yes.
Does it say what services they provided?
It shows that you got nursing. It looks like it was just skilled nursing. It was a nurse that evaluated you, and then there was the nurse did a visit for you.
And how many times did they help me? Does it say?
So it shows the one evaluation and it shows the visit. So probably about maybe 2 visits in total. No, I'm not sure what the agency determined from there. I'm not really sure what caused the case to only have like 2 visits or so. But that's also something that can be clarified with one at home Broward. And although we seem the same, how do I say this? We handle the documentation and processing for the home health agency that provides services. So we're not directly with the home health agency. I'm not directly with one at home Broward who serviced you in 2021. But further along the line, once orders are processed, we can provide the contact information. So let's say that everything goes through smoothly, right? And you just need to know when will your nurse arrive or when will your home health aide arrive. We can provide you the contact number for the agency directly, anything regarding scheduling, but we kind of got to get there first.
And then what's the name of the referring physician for the services in 2021 in Vero Beach?
Allow me one moment. It looks like this came from Anti-Forgery, let's say Fort Lauderdale Behavioral Center. It's kind of hard to see the doctor's name on the prescription itself because it looks like it was faxed over, but it was really kind of light, and the signature is over his name. But from our authorization, Azar Allow.
How do you spell that?
A like Apple, D like Zebra, H like Henry, A like Adam, R like Robert. Last name is Delau, that's D like David, A like Adam, L like Lima, A like Adam, L like Lima.
And does it say where his doctor's office is?
It says Fort Lauderdale Behavioral Health Center. And then it says the address was in Oakland Park, Florida. But if that's not your current doctor, then that wouldn't really be relevant to the home health services that you're requesting right now.
Does it say why I needed home health services?
It says, let's see. It says nurse evaluation for wound care twice. And then the authorization looks like it was authorized to one at home Broward. So it says nursing evaluation for wound care.
Nursing evaluation for wound care.
Okay, Mr. Armour,
So-
once again, I do have to drop off.
Yeah. Before I let you go, I also had a skilled nursing or home health aide when I was in West Palm Beach, Florida. And it was also one at home health services through Trinity Health or something like that. I think the home health care company was called Trinity Health, but it was through one at home health services or one home solutions or something like that.
I see something about that in 2017, and yes, we authorized Divinity Home Health Care to provide the services for you.
And does it say what?
And it says to assist with ADLs, and then it also says a skilled nursing visit. So the home health order, it requests for you to be assisted with ADLs, and it said for you to get home health aid.
And what is ADLs?
ADLs is assistance with daily living activities. So that may include things such as, like showering, cleaning, the same services that we listed out for home health aid, except it was authorized to a different provider that was able to provide more visits for you. And that was back in 2017.
And does it say what the services were that they helped
It
me
says it was skilled nurse. It says it was one skilled nursing visit, and then you had home health aid visits.
with? And how many home health aid visits were there?
It looked like, now I don't know how many services that were completed, but it shows that we authorized Divinity Home Health Care 240 home health aid visits in total. That's what I'm seeing on the authorization. Keep in mind, I'm not a home health aid coordinator, so I can't tell you exactly how the services, you get what I'm saying? I can't tell you how the services went. It was another provider that provided them directly to you. But authorization-wise, it shows that we authorized 240.
And does it say what exactly they helped me with? Like, did they help me with cleaning? Did they help me with getting my groceries? Did they help me with going to the doctor? Did they help me with showering? Did they help me with?
It doesn't tell me, but it may be because we're not the home health agency that provided the services directly.
And what did they? What services exactly did they cover? Does it say?
It just shows that they provided skilled nurse aid visit. I'm sorry, I'm not privy to that specific information for another home health agency.
It says that it covered skilled nursing.
Yeah, so it shows that we authorized one skilled nursing visit, and then that you had home health aid visits. It doesn't really tell me exactly what the skilled nurse does. Maybe it could have been an evaluation, but it doesn't tell me exactly how the plan of care went because I don't have access to that information.
Yeah, so they sent one nurse for the evaluation, and then they sent the home health care aide after that every day, and they were helping me with all of my things that I need help with: showering, cleaning, getting my groceries, getting my medication, everything, going to the doctor. It's the same situation. I need help again.
Okay, and so we did advise of, how to go about that process. The doctor would need to go ahead and send the order, and I sent the email to the supervisor. But I'm so sorry. I have to tell you, I do have to go. I can't stay on the phone any longer. You can ask our coordinators once that whole processing thing goes through. You can speak to our home health coordinators for further details, but we can't really guide you on exactly what the doctor is ordering. The doctor has to know. So if you need to tell the doctor that, hey, this is what happened last time, let's see if I can get it this time, then great. We can see how that goes about with processing, but I can't stay on any longer.
Okay,
I'm so
Helen,
sorry. I do
one
have
last
to go.
question. What was the referring physician's name?
From 2017,
Yes.
it says Smith Joseph, so Joseph Smith.
And where?
Okay, Mr. Omar, I'm going to drop off right now, okay?
Yeah, well, where is his doctor's office?
Give me one moment. It says this doctor was in North Miami, Florida. It's Joseph Smith. It doesn't tell me the name of the facility because these are portal visit requests. I'm not sure if this was initiated directly through Divinity Home Health Care because instead of being a traditional prescription, it looks like the home health agency sent us requests to authorize visits for services that they have been providing.
And does it say what health insurance I have?
It just shows as Humana, Medicaid, HMO.
And what Humana member ID number was it?
Allow me one moment.
And what was my address at the time?
So it's the same. So it's the same member ID. It's just that there's zeros. There's 2 zeros at the end of your current member ID. The address at the time, if you allow me a moment, I'll pull that up. But I can't really stay on the phone any longer. I am getting my leadership reaching out saying, hey, we're kind of on this call for quite some time. So I will have to go. But I'm going to give you this address, and then I'm going to go ahead and head out, okay?
Mm-hmm.
Okay, it shows that you stayed at 324 Lyman Place, West Palm Beach, Florida, 33409.
And how is Lyman spelled?
It's L like Lima, Y like youth, M like Mary, A like Adam, N like Nancy.
And does it say you said the doctor's name is Dr. Joseph Smith?
Mm-hmm.
Does it say if that was my primary care physician?
It doesn't, because it's not a traditional order, but I'm so sorry, sir. I'm going to go ahead and head out now, okay? Thank you for calling One Home.
Mm-hmm.
Bye-bye.
Jeremy. Of course, they'll hang up the phone.
If you are calling about a Humana Medicaid member from the state of Florida, press 1. All other callers, please press 2.
Humana Healthy Horizons in Florida. Para Español, marque 9. Calls may be recorded for quality assurance. If you need immediate medical services, please hang up and dial 911 or your local emergency service provider. As a reminder, interpreter and language services are free of charge. How can we help you today?
I need to speak to an agent.
Just to make sure, you're calling as a member, right?
Yes.
To get started, what's the date of birth of the person you're calling about?
December 14th, 1988.
That was December 14th, 1980, right?
No.
My mistake. To get started, what's the date of birth of the person you're calling about?
December 14th, 1988.
That was December 14th, 1988, right?
Yes.
Thank you. Which policy are you calling about? Medical, pharmacy, or Go 365?
Medical.
And one last thing. Once you're done speaking with a representative, if selected, would you like to take a survey to provide feedback about your experience?
No.
All right. One moment, please.
Thank you for calling Humana. This is Kimberly. How may I help you?
I need to speak to a supervisor.
Okay, I'll be glad to direct your call. May I have your first and last name, please?
Omar Mohsen Ibrahim Fuad.
Thank you, Mr. Fuad. And I see that you're all authenticated and calling from the number on file. And so that I can direct your call to a supervisor, can you tell me what this call is regarding?
It's complicated. It's necessary for me to speak to a supervisor.
Okay. And is this in regards to your Medicaid account or something different, Mr. Fuad?
Yes, my Humana Insurance.
Okay. Thank you. I am sending a request to speak with a supervisor. Bear with me so that I can get the okay to transfer the call. I'm still with you. Okay, I'm just waiting for a response. And Mr. Fawad, we have a callback number on file of 772-538-8586. Is that correct?
Yes.
Okay, thank you. I'm just waiting for them to give the okay. All right, go ahead and wait for me just a moment, and we will get connected to a live supervisor. Once I get them on the line, I'll conference you in with me, okay?
Mm-hmm.
Thank you for being patient. Jeffrey? Mr. Fawad?
Yes.
Okay, I lost the supervisor. Let me try to get him back. I'm sorry for the continued hold time. He just cut out. Okay, hang on with me, okay?
Mm-hmm.
Thank you. If you're calling about a Humana Medicaid member from the state of Florida, press 1. All other callers, please press 2.
Humana Healthy Horizons in Florida. Para Español, marque 9. Calls may be recorded for quality assurance. If you need immediate medical services, please hang up and dial 911 or your local emergency service provider. As a reminder, interpreter and language services are free of charge. How can we help you today?
I need to speak to an agent.
Just to make sure, you're calling as a member, right?
Yes.
To get started, what's the date of birth of the person you're calling about?
December 14th, 1988.
That was December 14th, 1988, right?
Yes.
Thank you. Which policy are you calling about? Medical, pharmacy, or Go 365?
Medical.
And one last thing. Once you're done speaking with a representative, if selected, would you like to take a survey to provide feedback about your experience?
No.
All right. One moment, please.
Hello, thank you for contacting Humana. With who do I have the pleasure of speaking with today?
I need to speak to a supervisor.
Okay, may I ask who I'm speaking with right now?
My name is...
And what is the issue?
It's complicated. It's necessary for me to speak to a supervisor.
Okay, what's your name?
Omar Mohsen Ibrahim Fuad.
Okay, 1 second. Okay, bear with me one moment, okay?
Mm-hmm.
Hello, Mr. Omar. I have someone who could further assist you, an account supervisor.
Thanks so much. Hi, good afternoon. This is Jasmine. I'm here as an account supervisor with Humana. How are you today, Omar?
Not good.
So sorry to hear that. I'm so sorry, by the way, you're having to call to request a supervisor. Should we get disconnected? Is the phone number 538-8586 still okay?
Yes.
I appreciate that. And what's going on today, Mr. Broad? How are we able to assist you?
Hold on. Somebody's calling me on the other line. Hold on 1 second.
Okay.
I think it's because I have a doctor's appointment today, but I'm not feeling well, and I need to reschedule. Could you hold on 1 second, please?
Sure, of course.
Thank you for calling Dynamic Pain and Wellness. If this and dial 911. If you would like to leave a voicemail, please press 1 now, and we will return your call. Please remain on the line to speak with a representative. Thank you, and have a wonderful day.
Please stay on the line while your call is transferred to the operator. Your call is very important to us. Please wait for the next available agent.
Dynamic Pain and Wellness, this is Kasera. How can I help you?
Yes, my name is Omar Mohsen Ibrahim Fuad. I have an appointment today at Dynamic Pain and Wellness in Tallahassee, Florida at 2 p.m. I need to reschedule, please. I'm not feeling well.
What's your date of birth?
December 14th, 1988.
Okay, give me just a second. I'll get you transferred to that department to reschedule. Dynamic Pain and Wellness, how may I help you?
I need to reschedule my appointment.
Can I have your date of birth, first and last name?
December 14th, 1988. Omar Mohsen Ibrahim Fuad.
Okay, do you need another afternoon appointment?
Yes, please.
Okay, one moment. Okay, the next one will put us on Monday, July 22nd for 2:30.
Monday. Is there anything tomorrow?
No, sir, not for an afternoon appointment.
What time?
If you could do a morning appointment, I could get you in for the morning.
I'm having difficulty sleeping. I'm not feeling.
Okay, so do you want the afternoon appointment?
What about on what's today's Monday? What about Wednesday? What appointment times available?
So you're going to our Tallahassee office. They're only open on Monday and Tuesday. So Monday you could do a morning or an afternoon. Tuesday would be morning only.
Monday and Tuesday. Is their address 325 John Knox Road, Building 200, Tallahassee,
Correct.
Florida 32303? They're only open Monday and Tuesday?
Correct.
Why is it only open Monday and Tuesday?
I could not tell you that. I'm so sorry. I do not know.
Is that new?
No, sir. It's been like that for I don't know how long.
It says they're open 5 days a week, Monday through Friday, 8 to 5 p.m.
They're only there Monday and Tuesday. So Monday you could do a morning or afternoon, or Tuesday you could do a morning. Which one would you prefer?
Monday.
Okay, so on the 22nd, can you do the 2:30 appointment?
I hope so.
All right, so we'll put you down for Monday, July 22nd at 2:30. If anything changes, just give us a phone call back.
Is there anything later than that?
The latest would be for 3:30.
Okay, 3:30.
Okay, so Monday, July 22nd at 3:30.
Yes.
All right, you're all set to go.
Thank you.
Thank you. Bye-bye.
Hello?
I'm still here with you, Mr. Over.
Yes, I need to call.
How can I assist?
I need to call my primary care physician's office to tell them to write that I need skilled nursing on the referral for home health aid.
Oh, okay. Let me take a look. All right. Have your primary care as Florida Medical?
I don't know. It's supposed to be Humana Medicaid.
No, I'm the insurance company with Humana Medicaid. I was asking who's your primary insurance company. You just asked me to call the doctor's office?
What did you say that again?
Do you have the phone number for your primary care doctor's office?
Yes. Yes, it is. It's 850 644 1444.
Okay. And you'd like for me to ask them to submit an order for what? I'm so sorry.
I was just talking to the supervisor, Jeremy, at Humana Medicaid, and we were on a conference call, and with the One Home Solutions for home health aid, and they were saying something about that the doctor wrote that I have chronic back pain and chronic neck pain, and I'm having difficulties cleaning and throwing out the trash. And but she said that he didn't mention that I need skilled nursing or something like that. And she said that he's supposed to mention that I need skilled nursing.
Oh, okay. Let me.
I need the same. I need the same services that I had 2017, which is the skilled nursing. I need help with cleaning and showering and my laundry and throwing out the trash and cooking and the same services that they provided me in 2017.
Okay, let me see if we can reach anybody from your primary care's office. 1 moment. Let me try them one more time. Their referrals department is going to voicemail, okay?
Could you call the other number? It's 850-644-1543.
Sure, let me know. I'm still here with you, Omar. I'm just going to join the calls while we wait. If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold. If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold.
Still here with him.
Mm-hmm.
If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold. If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold. If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold. If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold. If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold. If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold.
Still here with you, Omar.
If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold. If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold. If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold. If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, please continue to hold.
I'm still here with you. I may have to offer a call back at some other time if your primary care is going to continue to hold this long.
Could you hang up and try to call them again? Maybe they'll answer.
Yeah, I may have to offer a call back, Omar, because honestly, I can get in trouble for call avoidance. I do have to answer other calls that are coming in. So I will have to offer a call back. I have no problem with calling them. I would just have to offer a call back at some other time, maybe when they are slower.
What time? I need this. I need to resolve this as soon as possible.
Okay, I can continue to allow you to hold, and then I can follow up with you later today.
Yeah, but I need a supervisor to be on the line. Hello?
FSU Primary Health. If this is a medical emergency, hang up and dial 911. If you're calling for FSU Senior Health or FSU Telehealth, please hang up and dial 850-645-5050. Please choose from the following options. For general information about our practice, including office hours and location, press 1. If you're currently experiencing symptoms of COVID-19 or need to schedule a sick visit, press 2. To schedule, cancel, or confirm a wellness or follow-up appointment, press 3. For information about a pending referral or imaging order, press 4. To speak to a nurse or medical assistant, press 5. For billing questions, press 6.
There are currently
3
callers ahead of you.
Thank you for calling Florida State University. Your call is important to us. Please hold for the next available representative. Your call will be answered in the order it was received.
If you would like for us to save your place in line and call you back when it's your turn, please press 1. Otherwise, if you would like us to call you back at the number you called from, press 1. If you would like us to call you back at another number, the number we will call you back at is 77253888586. If this is correct, press 1, or to try again, press 2. Thank you. We will save your place in line and call you back at the number you specified. Goodbye.
You've reached FSU Senior Health, Doctors Lisa Granville, Savitri Ramdial, and Casey Rust. If this is a medical emergency, please hang up and dial 911 or go to the nearest emergency room. Our phone coverage hours are between 8 a.m. and 4:30 p.m. You've reached FSU Senior Health. Please choose from the following options. To schedule, cancel, or confirm a visit or follow-up appointment, press 2. To speak to a member of our clinical team, press 3. For information about a pending referral or imaging order, press 4. For billing questions, press 5. You've reached FSU Senior Health. Please choose from the following.
Thank you for calling Florida State University. Your call is important to us. Please hold for the next available representative. Your call will be answered in the...
FSU Senior Health. My name is Cindy. How can I help you today?
Is this the number for FSU Telehealth?
No, this is Senior Health. I could transfer you to Primary Health.
What's the number to Telehealth?
I'm not sure. You would have to be transferred to Primary Health. FSU Primary Health.
What's the number to the FSU Behavioral Health?
Behavioral. It's 850 644 6543.
Say that again. You said 850.
644 6543.
Okay. Could you transfer me there?
Yes, give me 1 second.
You've reached FSU Behavioral Health at Appalachia Center. If this is a life-threatening emergency, please hang up and dial 911. Please choose from the following options. For general information about our practice, including office hours and location, press 1. To schedule, cancel, or confirm an appointment, press 2. For billing questions, press 3. For all other calls, please press 4.
Thank you for calling Florida State University. Your call is important to us. Please hold for the next available representative. Your call will be answered in the order it was received. If you would like to leave us a detailed voicemail, please press 1. Otherwise, please continue to hold. Thank you for calling Florida State University. Your call is important to us. Please hold for the next available representative. Your call will be answered in the order it was received.
If you would like to leave us a detailed voicemail, please press 1. Otherwise, please continue to hold.
Thank you for calling Florida State University. Your call is important to us. Please hold for the next available representative. Your call will be answered in the order it was received.
If you would like to leave us a detailed voicemail, please press 1. Otherwise, please continue to hold.
Thank you for calling Florida State University. Your call is important to us. Please hold for the next available representative. Your call will be answered in the order it was received.
If you would like to leave us a detailed voicemail, please press 1. Otherwise, please continue to hold.
Thank you for calling Florida State University. Your call is important to us. Please hold for the next available representative. Your call will be answered in the order it was received.
Thank you for calling University Health Services. If this is a medical emergency, please hang up and dial 911. Otherwise, please choose from the following options. For general information, including hours of operation, please press 1. To schedule an appointment, please press 2. To reach the billing office, please press 3. For calls regarding insurance or immunization holds, you may reach the Health Compliance Office by pressing 4.
Hello, this is Omar.
Lakeisha. I'm returning a call from FSU Primary Health.
Yes, Lakeisha, I was talking to my health insurance company, a supervisor there at Humana Medicaid, and the supervisor at the One Home Health Solutions for the home health care aid. And they said that the referral has to say skilled nursing also, including with the information that Dr. George Whitten mentioned about the fact that I have chronic neck pain and back pain, and I'm having difficulties cleaning and throwing out the trash.
So he did your referral for home health aid, and they're saying that the information he sent over isn't detailed enough?
Yes, and also I had a home health aid when I was in West Palm Beach, Florida, and the services were skilled nursing and a home health care aid, and they they had to do, when they sent the referral, they had to mention skilled nursing because they had to send out a nurse to my house first so they could put together the treatment plan, I think it's called, for what I need help with from the home health aid that's going to be coming to my house. And they sent out the nurse, and then to the nurse to talk to me, and then we put together the treatment plan, and then they sent out the home health care aid to my house to help me with cleaning and showering and laundry and cooking. And
Hold on just a second for me. Hold on just a second. over to Dr. Witten to include skilled nursing with your referral order for home health.
Thank you, ma'am. And then also, could you mention, though, that I need help with all of those things? Specifically...
I put it in the message I sent to him.
Okay, thank you, Lakeisha.
You're welcome.
All right.
Centerwell Pharmacy over the counter. Para Español, marque 9. Calls may be recorded for quality assurance. Just to make sure, you're calling as a member, right?
Yes.
To get started, what's the date of birth of the person you're calling about?
December 14th, 1988.
Thank you. And one last thing. Once you're done speaking with a representative, if selected, would you like to take a survey to provide feedback about your experience?
No.
All right. Information provided is subject to the limitations, terms, and conditions of your plan. One moment, please.
Thank you so much for calling Humana. This is Shauna. How can I help you?
I need to check the status of the durable cane with large supports that I ordered.
And what's the name on the account?
Omar Mohsen Ibrahim Fuad.
Thank you. Let's see here. Bear with me. And what's the zip code for you, Omar?
32303.
Thank you. And a good callback number?
772-538-8586.
Thank you. Give me one moment so I can take a look and see what we have, okay? And this is for a cane with large grip?
It's called the quad cane, the quad durable cane with large support, 300 pounds.
Give me one moment so I can look into your account, okay?
Mm-hmm.
What's your can you confirm the mailing address we have for you on the file? And I do see there's an email of Angela Anderson 777 @gmail. Is that still a good email?
No, it's never been a good email.
Okay, let's get that corrected for you.
My email address hasn't changed. It's the same email address that I've had all this entire time.
All right, and what is that, sir?
Due diligence corporate @gmail.com.
Okay.
Do you need the correct spelling?
Is that EUEDILIGENCECORPORATE @gmail?
Say it again.
DUEDILIGENCE CORPORATE @gmail.com.
How did you spell the corporate?
CORPORATE or COO. I'm going to look in our internal system to see what's on file for you, okay?
Yeah, it's due, DUE, diligence, regular spelling, corporate, regular spelling, @gmail.com. So it's due diligence, corporate, @gmail.com.
Thank you. Let me just see what's on our systems for you.
They said that the previous person that I put the order in with they said they put the order in wrong, and it says that they ordered diabetic compression socks, but I'm not a diabetic and I didn't order diabetic compression socks. I ordered the quad durable cane with large support, 300 pounds.
Okay. All right, let's see here. And thank you for that clarification. I'm going to do the, Mr. Flo, I'm going to go ahead and correct that email for you, okay? And then we'll look at that for the quad cane. Now, did you order that through your over-the-counter benefit?
Mm-hmm.
Okay. I'll do is once I get the email corrected, I'm going to get you connected to the over-the-counter pharmacy department, and I'll advise what you're needing so they can better assist and give you a status on that, okay?
Who am I talking to right now?
You're with Amanda Member Services. But I won't release you until I have someone to confirm, okay?
It says that this is the number to call to order my over-the-counter benefits.
Right.
but we'll definitely get you to where you need to be. That's fine. You didn't make an error in who you're calling, but we can get you to where you need to be, okay? All right. Give me one moment, sir, okay? Mr. Fuad, give me one moment. I'm speaking with a representative from the over-the-counter pharmacy department, okay?
Mm-hmm.
One moment, sir. Mr. Schwab, thank you so much for your patience. I'm speaking with the rep. She's getting the information from me now for that equipment, okay?
Could you put them on the line, please?
I sure will. I sure will. One moment. Monty?
Yes. Yes.
I have Mr. Schwab online with me now.
Yes. Okay, okay. Give me that. One moment, okay, just put it in. Mm-hmm.
Mr. Flott, is there anything else you're needing from me today?
I just need to make sure that they're gonna deliver it because the previous person they put that I ordered diabetic compression socks, but I'm not diabetic and I didn't order diabetic compression socks. I ordered the quad cane with durable large support, 300 pounds.
Yes. Okay. I put the note that the member is active so they can check. And also the number 386, quad cane, large base, 300 pounds capacity. And we are going to process this order, okay? Okay, this is a total of $25, okay, for this month.
Mm-hmm.
All right. All right. Anything else that we can help you with?
What is the address that they're gonna ship it to, and when is it going to arrive?
I have here the address, Tallahassee, Florida. That's the correct address?
Yes.
All right. All right. They will process. It takes 10 to 14 business days. And you will receive a little bit sooner, but that's more or less the time that I have to let you know, that I have to tell you, okay?
Could you please tell them that it's urgent so they can send it faster?
They will, but they don't send these items faster, sir.
Well, because they were supposed to send it already, but they put the wrong item.
Yeah. Well, it also was showing in our end that your cover was ended at the end of June. That's why they didn't do more. Now they got fixed, and now it shows there that you have cover for this month.
No, I ordered the cane last week, but they put that I ordered.
I understand.
Diabetic compression socks.
Mm-hmm. I understand, but it was showing, the order was showing also because it was showing that you don't have you will receive it sooner, but they will not send this right away, okay?
So, what were you saying? It says I don't have what?
You will receive soon, but they do not rush these items. They don't send these 2 days or 1 day, okay? These come from Ohio, and they take a little bit longer.
But it does say I have insurance that covers that, right?
Yes, for this, yes. Mm-hmm.
Since when?
It shows there, and on my benefits, it shows there that you have the benefits starting this month. But it was, when they checked, they didn't see it. They was not showing that on the computer.
When did they check?
We checked today. They checked before, but I checked now with the member that called, the Humana member.
I'm still here.
Yeah.
I just want to ensure that what if you needed anything else. She was able to locate your plan and see that it was active as well on my end. That's what she's saying, Mr. Ford.
So, when they checked last week, you said I didn't have coverage?
It was showing that you was inactive on 6/30, June 30.
June 30.
We are just the pharmacy. We just check and look that program that let us know the benefits of the members. as a guidance,
What insurance did it say I had on June 30th?
Well, your insurance was good to June 30 was Humana.
And which insurance did it say I had?
The same, you have it now. Insurance, they are active for the same insurance to the end to this month.
What insurance did it say I had on? When you said I didn't have Humana insurance on June 30th, what insurance?
I only see the Humana, sir. I only say the Humana. I don't have too much information. It only say Humana Medicaid. That's all.
It doesn't say what insurance I had when it expired, or
Humana Medicaid. Yes, that's it.
And you said it's only good until the end of this month?
Well, because we have the system is, that we see is only outdated month to month. At the end of the month, that we put it again to. If you are active to August, at the end of July, it will show on the computer that you have benefits for August. So they show month to month. They don't show from when to, maybe to 3 years or to next year. They only show us month to month. That's the information that we see. That's all for privacy.
And what's the shipping number?
What does that mean, the shipping number?
Like if you order something and then they send it with FedEx or UPS or
Yep.
They usually have
they can use any of these companies at the moment that they are ready to place the order. We don't know which company they are going to send at the moment.
Do you know when they'll know?
You can call in 2 or 3 days. The order should be put in 2 or 3 days to verify.
Is there an order number right now?
No, sir. We send that to the other department. They have to do the same thing that I did, process the order, and double check that in the same information. I already put the orders. Okay.
So is there like a confirmation number that I put the order in?
No, at this moment, sir.
So how do I know that they put the right order in?
You can call in 2 or 3 days.
But you sure that you put the right order in?
Yes, sir. You tell us you want to order the item 386, the quad cane, large base. That's the item.
And that's not any other item, right? That's only the cane, right?
No, that's the only item for that number.
And that's the cane?
Yes, sir.
That's not the diabetic compression socks, right?
No, sir.
Is the supervisor still on the phone?
I'm not a supervisor. I'm member services. Mr. Flood, I can give you a reference number based on our call and conversation and connecting you to Centerwell. So I can give you a reference number that we did reach out to the pharmacy on your behalf to give that information so they can place that order for you. I will give you a reference number.
What's the reference number?
100 048 001 5888. And that's notating what you wanted to order, that we connected you to the Central Pharmacy so they could place the order. I did provide the correct product code to Medi, so they can order the quad cane for you, large space, 300-pound capacity. So for reference that we did get you to the pharmacy for that equipment, that's the reference number based on our conversation, Mr. Fuad.
And today is Monday, July 15th, right? 2024?
Yes, sir. Yes, sir, that is correct.
And you said 10 to 14 days is going to arrive?
10, it could be 7 to 10 business days. It could be sooner, but that's what the time frame that we'll tell members.
Okay. What time is it right now? Is it 2:26 p.m. in the afternoon?
Eastern time, yes, sir.
Okay. Is there anything I could do for either one of you?
No, Mr. Fuad, I was going to ask you that, are you okay?
Oh, I don't
that
feel good.
She's got the order placed for you and submitted, so I just wonder if there's anything else you needed from me today.
I don't know. I don't feel good, and I'm trying to fully recover. And every time I try to fully recover, something happens. Somebody makes it more difficult for me. Somebody makes me more sick. Somebody makes me more injured. Somebody lies and falsifies a report.
No, sir. No.
It keeps happening over and over. The same exact thing I just said.
I did notate your issue of, the incorrect order was placed, but we do have you at the correct department, so she can get that sent out to you. That the previous order was incorrect. Yes.
And what's going on with the, do you see the complaint about the unsanitary transportation vehicles?
Let me see here. Let me just
Okay. I already took the order. Can I, if he doesn't need nothing else, I can just...
If he has nothing else as far as any over-the-counter items, I can go ahead and complete this. We'll take a look at his other issues, okay?
All right. Thank you. Okay. Can I disconnect the call?
Yes, ma'am.
All right. Thank you so much, and have a great day, both of you, okay?
Thank you, Almighty. Thank you so much for placing that order.
Thank you.
Thank you, Mr. Fuad. Let me just take a look back at some information, okay? All right. Be here. And looks like that was today that you, give me one moment. Give me one moment to take a look, okay, Mr. Fuad?
looking at your complaints. I do see that. Was that in May? Due to the vehicle's unsatisfactory. Mr. Fuad, are you still there?
Yeah. Was it just that one complaint that they documented?
I see where it's got a due date of August 27th, so that's the I do see where you have reported this. Let's see. See, there's two issues. That's the initial, the second on June 10th.
Is that the only incident they documented?
No, I see there's a couple. Looks like there's one's for there's the May issue, and then there's another issue that happened on June. Is that correct?
Yeah, but there was more than two of them that they told me they documented. It happened several times. It kept happening when they were bringing me to my doctor's appointment and then bringing me home from my doctor's appointment. Some of those times were worse than the others in the sense of the vehicles being unsanitary and sometimes smelling toxic and unsanitary, and the seats being dirty, and I ended up having to go to the emergency room after my doctor's appointments, and I kept complaining about that, and they
Looks like there's a third one. There's a third one that's earlier in May.
And
then there's several here that I'm seeing. There's several here.
How many altogether are there?
Let's see here. Looks like there's a March where you called in, and then there's May. Or there's another you just submitted today as well.
Did they document the one in Vero Beach?
Let me pull that up.
There was more than one in Vero Beach, but did they document any of them in Vero Beach?
I'm pulling those up. I've got to open each one so I can see what it shows for me, okay? So just bear with me a moment. Was this to your neurologist?
in Vero Beach or in Tallahassee?
Okay. I'm looking at those. Just a moment.
Because they did it twice. They did it when I left the neurologist here in Tallahassee at Dr. Winston Ortiz's office at the Tallahassee Neurological Department at the Tallahassee Memorial Hospital. And they did the same thing in Vero Beach when I went to the neurologist. And I ended up having to go to the emergency room.
I do see where that one's listed, that you have to go to the emergency room. I'm looking at your case history so I can look back. Okay. Let me go into your previous plan information so I can see those records as well. Just bear with me a moment. Prior to July, I'm going to go into to look at your case notes from there. All right, I do see that. That's notated. That was from June 10th.
The one in Vero Beach?
Because is that for the allergies to the mold and smoke?
Yes.
Yes, that is documented, sir.
What about the ones in Vero Beach?
All right, let's see. Give me a moment so I can go back and look there. What is that provider that you were seeing there in Vero Beach, so I can make sure I'm looking at the right?
I don't know. Yeah, my address was 3981 46th Place, Vero Beach, Florida, 32303. I mean, 32... I don't remember the zip code, but it was 3981 46th Place, Vero Beach, Florida.
Okay.
I've got to close out some things I'm looking at. A moment. Excuse me. I'll have to go back a little ways, just bear with me. What I can do, see if we can escalate you to the appeals department. If you're wanting status of different complaints. One moment, sir. Was this for a 6:35 a.m.? You're traveling 8 miles. Is that the Vero Beach? Specifically. That was another one that was for an unsatisfactory vehicle.
Does it say what appointment I was going to?
It says in this case, you're coming from a neurology appointment, is that correct?
Does it say the address on there?
I'm not seeing the address on here.
Does it say the name of the neurology office?
Let me go back, sir. Because I have to look at the case that it was related to when you called in, so just bear with me, okay? I'm waiting for it to load for me. Just bear with me, Mr. Fuad. What I will do, because I'm seeing there's several here, I'm going to escalate this as well, Mr. Fuad, that you're requiring or requesting all detailed information from your previous grievances, complaints that you filed. Okay?
Does it say the doctor's name that I went to?
No, I'm not seeing that, sir. It's just showing me, I just can see the information in regards to what was happening, the situation, unsanitary transportation vehicle that was making you sick. It's from your neurology appointment. But let me see, based on that alone, let me see who displays during that time frame as the neurologist that you saw. Okay? Mm-hmm. Now, at least we can look at it that way.
And that's the one from Vero Beach, right?
I'm not sure of the location because it's just in neurology. So let me take a look here to see.
It's not the one in Tallahassee though, right?
That was June. Dr. Chatsworth at Wadsworth.
What was his name?
Wadsworth, Dr. Wadsworth.
Wadsworth. I thought his name was Dr. Ortiz.
Let me look here.
Does it say his first name? Was his first name Jaime or something like that?
Let me look for you. Let me see what we have for you. He said Jaime?
He said he was a retired doctor that was helping Dr. Ortiz. He said his first name was Jaime. He wouldn't tell me his last name, though. And he ended up injuring me. He left large bruises all over my neck and my arm when he was sticking large needles in my arm and my neck.
No. Sounds like you've been through quite a lot.
Yeah, and every time I complain, they retaliate against me more.
No.
Sometimes they do it right away. Sometimes they do it after a little bit of time passes by.
All right. Let me get this. I'm going to send... I've notated the discrepancy for your initial call-in, but what I'm going to do, I'm going to send this forward as well as a request to go through all previous complaint information. Okay? Mm-hmm. I'm going to send this forward for you, and then I'll give you a reference number for that as well, Mr. Fuad, okay? Mm-hmm. All right. Give me one moment to get this started.
so you can have accurate information. This will go to the appropriate department and they'll follow up with you. Just in the same moment. I've got to close out where I'm at so I can submit this for you.
Were you able to see the location in Vero Beach for that complaint, though?
What I can see, it's not showing me an address. That's my issue. I can't see the address there. So that's why I'm going to send this forward. I want to escalate it forward higher so they can give you that information, more detailed information than what I can see.
And what is the doctor's name that it said it was?
You said Jaime was the doctor that you said? Dr. Jaime?
That's what he identified himself as to me.
Okay.
So what does the name say on the computer?
Let me see here. Let me go back at your phone. Going back through your authorizations, who that would be. I'm trying to find that information. That's it. Radiologist. Let's see here. With Tallahassee Memorial Healthcare Incorporated.
The one in Vero Beach, particularly, what information does it say about that one?
Okay, I have to go back and look at some of the claims and authorizations that you had, so I can look at that provider's information. That's what I'm trying to find for you now. Okay.
Mm-hmm.
All right. And thank you for your patience, Mr. Flo.
Mm-hmm.
May I ask you a question, Mr. Ford? Do you remember around the time that you saw this provider?
I don't. But it should,
you don't? Okay.
It should say it when I was at Vero Beach.
All right.
What are the authorizations for when I was in Vero Beach?
I'm looking that up now. That might have been on the two. Let me just do a quick search a different way so I can pull it up. Okay.
Is the computer slow?
Yes, just a little bit it is, because I'm going into older information for you to find that information for the neurologist or the specialist there in Vero Beach is what I'm looking for you.
It was prior to January of 2023.
Before January 23? Okay.
January 2023.
Okay. Give me a moment. I've got to look in one of your older plans, okay? I'm going to go before January 23.
Yeah, I moved to Tallahassee, Florida in January of 2023. And before I moved to Tallahassee, I lived in Vero Beach, Florida.
Okay.
And then before Vero Beach, I lived in South Florida.
Okay. I'm going to put you on a soft hold. Just bear with me a moment so we can look further than that, okay?
I don't want to be put on hold.
Okay. I'm still here. I'm just going to be quiet so I can search further for you, okay? Now that you've given me kind of an estimated timeline, all right? Mm-hmm. Okay.
Hello?
Thank
Thank you, Mr. Flatt, for your patience. Allow me to look further. What I'm going to do, I'm going to include this in what I'm sending forward as far as your investigations. Did you have previously to include neurologist information from Vero Beach? So I'm going to, like I said, I'm going to escalate this further. Okay.
Yeah, you told me that already.
Yes, I just want to let you know that I'm going to include this as well. What I said to begin with, to get you information for all your previous complaints, you wanted updates in that information, but I'm also including this request as well. What we're sending forward, what I'm sending forward for the provider's name from Vero Beach. Okay.
Are they going to email me that information?
I'm not able to, but I'm going to send it to an escalation department. Then they will contact you back in regards to this request. Okay.
And what's the name of that department?
It's our escalations department.
So what information were you able to find out about the authorizations from when I was in Vero Beach?
I'm not seeing that. That's why I want to send that forward, because it's so far into your files. They will be able to pull that at a glance as well.
What are you able to see from when I was in Vero Beach?
1 second here, Mr. Ford. I've changed screens. Just 1 second. Bear with me a moment. I've got to close some things out. One second, sir. I'm going back now. 1 moment. Excuse me. Let's go back. Indian Missouri County. The only thing that I'm seeing is the Ira Falelchi sound familiar as far as the provider?
How do you spell it?
Ira, I-R-A, Falelch, F-R-E-I-L-I-C-H.
Was that prior to January of 2023?
Yes, that was around August. No, I'm sorry, that's after. I'm sorry.
What do you see from when I was in Vero Beach?
Okay. There was a provider that was, I can't say this name, so I'm going to spell it. The first name is Oskar, Oszkar. And the last name is Szentirmai. And this was for spine and lower back. Does that sound familiar as far as the provider?
Yeah, what?
That was September of 22.
September 22. Does it say does it say Vero Beach?
It's Port St. Lucie, Florida. And then there was a Jensen Beach that was the provider that was requesting it.
What else does it say? Prior to January 2023?
Let me look here. All right, so that's one that was for your spine. Excuse me. Let me go back out. I have to exit out once I go into one and look at another one, okay?
Mm-hmm. Does it say what the provider's name was at that time?
That's the name I just gave you. Yeah, that was...
So what I mean by, what is the primary care physician's name at that time? Does it say?
Yes, the requesting doctor would be the Access Health Physician Services.
Does it say what the doctor's name was there?
No, it just has the group name. Let's see, that's one. Now that shows that you saw a provider in Orlando as well, but that's not the right one that we're looking for. That is the only one so far that I'm seeing from before that date that you provided. Excuse me. That was for your spine. And that was Access Health Services.
Does it say the address of the location for the spine doctor?
Yes, let me pull that back up. Are you needing a new referral for a neurologist?
Yeah, but what's the address of the spine doctor that I
For
saw?
that, yeah, so for this one, it was 10050 Southwest Innovation Way, Suite 102. And that was in Port St. Lucie, Florida.
Let me just confirm something. Do you need an updated list? Would you like an updated list? A neurologist?
Yes. Hold on.
Okay, I can get that for you. One moment. That's in your area that you're in now, okay? I'll get you some information for one that's in your area now. Yeah, this is the neurologist. That one I just gave you. That was the neurological surgery physician. Let me give you something updated, Mr. Fuller.
You said his name is first name Oscar or Oscar?
Yeah, Oscar. I believe you said that. I think you said that right. Oscar, and it's Zementari, Tamari. But let me.
Could you spell that, please?
I sure will. Just one moment. That is S as in Sam, Z as in zebra, E as in Edward, N as in Nancy, T as in Tom, I as in igloo, R as in Richard, M as in Mary, A as in apple, I as in igloo. Let me pull that up in your current zip code for neurology physicians, okay? Do you have a preference if it's a male or female?
Female.
Female, okay. I'm going to have to spin that out a little bit based on your demographics because basically all the neurologists I'm seeing are male. So are you okay with me extend that search out a little bit for you?
Mm-hmm. Wow. So I had to go 33.2 miles from my house in Vero Beach to see Dr. Oscar Centermy for neurology.
You do have you have transportation if you choose to use that. I do see there's a Vero Beach location, 32960. Let me look that up. Do you want to go back to the Vero Beach area?
No, I'm trying to find out what authorizations there are from when I was in Vero Beach.
That's the neurologist, and he does have a Vero Beach location.
What is that location?
Let me see. Excuse me, Mr. Hello. Okay. It was the Indian River Medical Center, and it's 1036th Street. In Vero Beach, Florida.
And what was the authorization for that for?
That was for the neurologist, the Dr. Oscar. That was the neurologist. That was in Vero Beach. He has different locations. And that's one of the locations.
Yeah, I remember this location.
Okay.
So they did they authorize it for this location or the one in Port St. Lucie?
It looks like let me go back to the authorization. It looks like the Port St. Lucie was the location that you were to go to and offer that authorization.
But I said I lived in
that was when you had the older authorization for Dr. Oscar. It was for the Port St. Lucie, Florida location.
But I lived in Vero Beach. You know what?
Now, when I'm looking for the neurology physicians now, and you said you prefer female, they're all coming up as male. Are you okay with that?
No, I don't want to talk to any more male doctors. It's becoming a nuisance at this point. It's like they're trying to compete with me or something. I don't. But so what's going on with the investigation?
That's why I need to escalate it so they can respond back to you directly, follow up with you in regards to those investigations, okay? I have to send that forward. And that's what I was doing before we went into searching for the provider. So,
does it say when they opened the investigation?
I've got to go into another system a moment.
Yeah, because what I see here is they authorized it and they billed Humana for these doctor's visits, right? My Humana Medicaid.
Mhm.
Yeah, but they said they billed Zurich Insurance. So did they bill Zurich Insurance or did they bill Humana Medicaid?
Let me see here.
Because they were also sending me unsanitary transportation vehicles. when I was having to go to the doctors in Vero Beach, and they were trying to tell me that they were billing Zurich Insurance, not Humana Medicaid. But you're telling me that they authorized me to go to these same doctors when I was in Vero Beach. So they're lying to me. They're, what do they call it, wasting policy. They're making me more injured. They're making me having to go to the doctor more. They're giving me misinformation. And they're sending me unsanitary transportation vehicles and telling me that it's going through a different insurance company that's causing that to happen, which I knew they were lying all along because of the pattern that's been forming. But you know, I'm one person that is on Social Security disability income. I'm injured. I've got injuries to my upper and lower extremities. You know, and I'm one person. I'm an injured person up against an entire council that's got secretaries and unlimited resources, and you know, I moved all the way to Tallahassee, Florida for my safety, and they're still harassing me the same exact way they were harassing me in Vero Beach and in South Florida. My family spent $240,000 on a brand new construction property, so I wouldn't have to live in uninhabitable rental properties infested with molds and filth and pests. And the problems at those places were I was living in an uninhabitable rental property, and they were sending me unsanitary transportation vehicles, and they were harassing me, and every time I'd complain about them harassing me or sending me unsanitary transportation vehicles or discriminating against me when I'd go to a doctor or a hospital, the same thing is happening now, but the only difference is I'm not living in an uninhabitable rental property and having to go through that. And every place that I was only able to find to live previously was an uninhabitable rental property, because that was all I could afford, was approximately $750 a month, which is what I was receiving on Social Security disability income. And I had to spend all of my money that I received from Social Security to find a place to live so I wasn't homeless and trying to fully recover from my injuries. And it was very difficult to do anything. And they were trying to use one situation to cover up another situation. And they were doing that in a way to keep me sick and make me have to continue to go to the hospitals and the doctors. And they were orchestrating the places that I was only able to find to live on Craigslist with people who were purposely already living at those locations and purposely harassing me and maliciously harassing me and acting like they were maliciously prosecuting me to try to scare me out of complaining. Because everything I was complaining about, I was documenting, and I have evidence proving it clearly and convincingly, far beyond a reasonable doubt. And I only need clear and convincing evidence proving my complaint beyond a preponderance of evidence. And they're doing the exact same thing to me here in Tallahassee, Florida, which is they have people who are living around my house, similar to Vero Beach in South Florida, who who are harassing me the exact same way. They're unethically hacking my phone. They're electronically harassing me. They'll make comments outside of my house about things that I'm literally documenting on my phone in real time. And they'll be harassing me in accordance with things that I'm documenting on my phone while I'm documenting them. And the only difference between here and in Vero Beach and in South Florida is that where I'm living now in Tallahassee, Florida, it's a brand new construction property, but they're still harassing me. And when I was in Vero Beach and in South Florida, they were harassing me with people who were living at the same house that I was living in, because I was renting a room in those uninhabitable rental properties that I was only able to find on Craigslist. And there were people who were living around those uninhabitable rental properties in Vero Beach and South Florida who were also harassing me. The same way the people who were living inside the uninhabitable rental properties were harassing me. And it was torture. I mean, I literally felt like I wanted to kill myself.
No.
And no matter how much I complained to the police, to the White House, to the FBI, to the CIA, to the local and state law enforcement, 911, to the hospital, to the mental health departments at the hospitals, they didn't care. They purposely kept doing the things that I was reporting, and they did it worse. It's like as if they were trying to make me give up and kill myself. And it's as if they were forcing me to live just to suffer.
Are you still feeling that way, Mr. Fuller?
Yeah, I still feel that way. I just don't feel like killing myself.
Okay.
But I feel like I'm gonna end up dying because of this, and I feel hopeless.
Bear with me a moment.
And I also feel like I'm going to be forced to defend myself against my opposing counsels and or their friends. Because the pattern that's been forming, it's proving that these people who are harassing me are my opposing counsels and or their friends. And my opposing counsels are government employees. And they're billing my government Humana Medicaid health insurance every time I'm complaining and having to go to the doctor or needing medications or going to the hospital. So they're aware in real time every single time I need help and have to go to the doctor or the hospital or need medication or complaining. So they're able to orchestrate these malicious types of harassment during, before, and after every time I'm having to complain or go to the hospital or the doctor or need medication.
Hey, give me one moment. I'm going to get you. Would you like me to connect you with your behavioral health vendor so you can speak with someone?
Yeah, but when did they open the investigation?
I'm not able to go back. I'm only to see. It's limited to what I can see. That's why I'm submitting that request for someone to reach out to you. Excuse me.
Are you
in regards to your complaints?
Are you able to see that they opened an investigation because of the unsanitary transportation vehicles?
I saw all that. Yes, sir. I do see those.
What day did they start that?
without moving from plan to plan. One moment. I'm first looking at your
Does it say what?
and what the plan file I'm looking at. The most recent in this particular plan, I'm looking at March.
So what day does it say they started the investigation?
It was, what I'm looking was first reported. It's March 26, 2024.
And does it say that's when they started the investigation?
This is for the transportation for the vehicle.
Yeah, does it say that's the day that they started the investigation?
Yeah, that was when it's open based on your call.
But does it say that?
Forward to, I'm sorry, go ahead.
Forwarded to who?
It would have went to our escalation department.
And does it say that
at that time they were called our resolution team, but they're called our escalation department now?
And does it say that an investigator called me to open an investigation about the unsanitary transportation vehicles?
I'm not, let's see here. I'm limited to what I can access when I'm looking at this to see those additional notes.
She was
because of my level.
She sounded like an elderly white lady. She had like a really raspy, hoarse voice, like she was a smoker.
Mhm. Mhm.
Do you know who I'm talking about?
No, I wouldn't know particularly who you would have spoke with. Let me see. Let me go back here. One moment. It was routed on the 26th. It looks like you spoke with a representative that was here.
What was her name?
that took the call was Tierra.
If somebody called me specifically.
Okay, so that would have been our resolution team. Let's see who that was. Let me see. This is why I need to continue to move this forward, because the department that can see further into this than what I can, that's what their specialty is. As far as who would have called you, they can see all of that, where I'm limited at the access that I can see. And my apologies in advance for that. It's not allowing me to open that up.
And when is the escalations department going to call me?
Well, once this is submitted to them, they'll review it and then reach back out to you. As far as the time frame, let me see here. Let me give this information to you as far as the turnaround time.
Was it true what they said yesterday about the Donald Trump getting shot in his right ear?
I've heard multiple stories. Hopefully he's okay.
So he really got shot in his right ear?
I think it was, from my understanding, it was glass that hit him from the incident. All right.
They also said he got shot in his arm or his hand or something.
I don't think that was true. So let's see here. So allow 24 hours from the time that a complaint is filed. So in regards to today's issues for both the issue with the misorder with the Centerville Pharmacy and then what we're discussing right now, allow 24 hours from the time the complaint is filed, okay?
Okay. You know what's really weird is, all these names of these doctors and these situations and the people who I'm calling and how they're identifying themselves and the names that they're using to identify themselves, it's all relatively connected to the complaints that I'm making. I mean, sometimes their names are almost identical to the situations. Like it's almost impossible that it's even their real name because of how relatively connected their names are to the complaints. And my primary care physician, his name is Dr. George Whidden. And Whidden means ear in Arabic. And I'm Middle Eastern, I speak Arabic. And his name is spelled Whiddon. And then now I'm hearing that Donald Trump got shot in his ear.
Mm-hmm. Yeah. Maybe that's
And they said he got shot in his ear while he was talking about immigration or something like that.
Oh, I don't know if that was the case. I just, seen that on the news. So what I'm going to do, I know you're looking for that specialist, but what's coming back is male providers. Do you want that list to be extended out further, Mr. Flood? Because I'm only finding it's only males that's in your county and in your demographics that's displaying for neurology physicians. If you, like when we were talking earlier, you wanted to update a list for neurologists, but it's still coming up as males. How far out would you like me to extend this search so we can find a female provider?
100 miles.
Okay. We'll do that.
And also, I need an ear, nose, and throat doctor.
Oncology? Okay. Let me get that for you. Okay.
And then I also need a foot doctor.
Ortho. Mm-hmm. ENT, and then once I extend that search out further, I was able to. And do you prefer all these to be female?
Yes, and I also need a hand doctor.
Okay, so we'll look at ortho for both hand and lower extremity.
That's the same doctor, feet and hand?
Yeah, sometimes orthopedic physicians, specialists, they do both areas of specialty. Okay.
Because my left ring finger, it hurts. When you bend your left ring finger, or when you bend your finger and the bone that's attached to each other that makes it bend, that bone in the middle, the side of that bone where it bends in the middle, on the sides of the fingers on both sides, it hurts.
Oh no!
It's been like that since November 23rd, 2021.
Okay. You want it to be sent to the due diligence corporate?
At gmail.com. Yeah.
At Gmail. Okay. Let me get this ready for you.
And also, I need a nutritionist.
All right, so we're going to get ortho for hand and foot, ENT, neurologist, nutritionist.
So I'm going to send this list to you to duediligencecorporate@gmail.com. One moment.
And also an eye doctor.
For vision as well? Okay. And all these need to be female? Okay.
Preferably Arabic speaking.
Let's see if I can sort it by ethnic, okay? All right, this first list is going to come to you from a do not reply at humana.com. Let's see here. If it's not in your inbox, check your junk or spam. One moment. Let's see what we can find. And then to click the PDF attachment within the email to view that provider information. The first one was the neurologist. Okay, now I'm going to send, let me go ahead and send for vision for you now. And this, the only one that I had to extend out further was for the neurology so far. So if I should have to extend the other list out further, I'll do so, okay?
Mm-hmm.
All right. All right. Were you able to receive that first list, Mr. Flood? There's one that comes up for vision in your city, in Tallahassee, okay?
Mm-hmm. Could you write on the email that you're sending me what this email is for? Like, for example, you just sent me an email with a PDF attachment of neurologist. When you send the email, could you mention in the subject title or in the body of the email that it's for a list of neurologists that are within the network of Humana Medicaid?
It's going to be in general. It doesn't allow me to minimize it that way. I'm so sorry.
Well, could you just
I wish I could.
Because they've sent me.
Let's see here. Let me see here.
Or at least just put neurologist.
Okay.
So it's easy for me to find.
All right. Okay. Bear with me. Let me see if I can modify it just a little bit, okay?
Mm-hmm.
All right.
do the first one. I'll have to add a, Phil Wells going to add a cover page for you, okay? All right. Did you get that first one?
Yes. But it doesn't say neurologist or anything.
No, that first one won't. You want me to resend it?
Yes, please.
Okay. All right. All right, let me resend the other one I just sent you. That was for vision, the one that's coming now. Let me submit the other for neurology. Okay.
That one doesn't say.
And you'll see it's got.
It doesn't say
I'm
vision.
sorry, say it again.
It doesn't say vision either.
It's going to have a cover page to it. It's going to say it on the cover page.
Oh, okay, I see it.
Do you see it? Do you see it? Okay. Alrighty. Bear with me so I can get the other one modified for you, and then we'll do the rest of them the same way so you know what they're for.
So the vision, the optometrist is only one optometrist in Tallahassee?
Mm-hmm. Yeah, one female. That was out of all the ones, when I narrowed it down based on gender, that's what it gave me.
Are there any that speak Arabic? Male or female?
Let me see. For which one? For the vision?
For any of them, vision.
Okay. I have to do it. I have to do it individually, so just bear with me, okay? I'll have to go back in and do this one over. Let's see here. All right, so the ones right now, this is for the neurology. It's going to make the list a little smaller, but I selected for Arabic speaking, okay?
And I need a referral from my primary care physician for all of these specialists?
With the exception of the vision. And, yeah, with the exception of the vision, that's the only one you won't.
Are there any specialists other than vision that I don't need a referral for?
Which the only one that you don't is OBGYN, and that's not applicable to you. And that's whether it's, pregnancy or non-pregnancy related if you have to see, but that's for a female provider. But regions 1 through 11, any specialists outside of that, OBGYN, you do need a referral.
Other than vision?
Yeah, vision and OB doctor. And this is...
What doctor would I go to donate?
To donate what, plasma?
I could donate plasma?
No, I'm asking, what do you mean to donate? What do you mean to donate? May I ask?
Donate anything, like a plasma or sperm or blood or anything.
Let's see here. For that would be like fertility providers. All right. So we've got your neurology. We just said vision. Let me get the ENT for you now, okay?
Sure.
Bear with me a moment.
I'm going to search that a little further for you as far as the ENT specialist, okay? When I narrow it down to female, it doesn't show me for Arabic speaking. Are you okay if it's a male or female for the ENT? For your...
Arabic speaking, yes.
Okay. I may have to extend that out a little bit. Now, with the ENT, I don't have the option for Arabic speaking. Is there a, I even extend it out to 100 miles.
I guess just a female.
Okay. All right. All right, so let me get this one sent to you, just a couple of them now. All right, there's your ENT. It's going to come in at do-not-reply@gmail.com. If you don't see it in your inbox, check junk or spam. Let me get the ortho. So you should have received neurologist, ENT now, vision. So let me get you the ortho, okay?
Mm-hmm.
All right. Now with the ortho, I've gone out as far as 75 miles. All of the orthopedic surgery physicians have been male. I'll go out further.
Are there any of them that speak Arabic?
No, sir. Oh, wait a minute. Let's see here. Let me filter this. Oh, no, it says I don't have a match here. Let me go back. See if I can find one that speaks Arabic. Okay, I had to go out a little further, okay? Quite a bit further.
I need to use the bathroom. Could you hold on 1 second, please?
Sure, I'll continue to generate the list for you. Take the time that you're for.
And were you able to find a nutritionist?
Okay, that was the next thing. I didn't know you were back yet. I want to give you some information in regards to that. For nutritional counseling, based on your region, that is for all regions. Are you able to hear me? I'm so sorry, I'm moving around. All regions for Florida. I'm going to give you a contact number, a fax number, and an email phone and a phone number for ILS. So what that is, just have your provider would have to submit for a referral, just like if he or she would for any other specialist. So I'm going to give you the nutritional counseling information. Okay.
Yeah, I called them, but they didn't help me.
The ILS.
Mm-hmm.
Do you want me to look for a dietitian instead of the nutritional counseling?
What's the difference?
They're almost similar. Let me see here. Let me pull it up here. So let's see here for in their descriptions for a dietitian. Registered dietitian. Let's see. Let me pull up their descriptions in a moment. A registered dietitian is an individual whose training and experience are in the area of nutrition, who has the ability to apply that information to the dietary needs of the healthy as well as the sick. So that's what a registered dietitian does. Let me see what the nutritionist description shows us as. Person who advises on matter of food and nutrition impacts on health. And that's the description for a nutritionist.
What's the difference?
One advises on the matters of food and nutrition, impacts on the health. And then the other, for the registered dietitian, that description shows us as, let me pull that back up for you. Registered dietitians are individuals whose training and experience are in the area of nutrition, and they have the ability to apply that information to the dietary needs of healthy individuals as well as sick individuals.
And what's the difference?
It seems like there might be one and the same. Like both have nutritional experience, That's what their focus and experience is. So would you want information for a registered dietitian?
Yes.
Okay. All right. Let's see what we can find there for you.
So they don't have any nutritionists at all?
For the nutritionist, let me go back. Let me see what comes up for me.
Because when I was in South Florida, they assigned me a nutritionist. I'll tell you what her name was. It was through Humana, Medicaid.
Now for the nutritional counseling, that's what the nutrition at ilshealth.com is. That's for the nutritional counseling.
So when you type in nutritionist, it says go to ils.com?
Mm-hmm. What for nutritional counseling? It's for all regions in Florida, so that may be of who you had for the nutritional counseling. And I can give you that contact fax and email. And it's just for all regions in Florida.
Is there anybody other than them?
No, when I'm pulling it up, it doesn't give me information, and that is in the 100-mile radius. That's both for the registered dietitian as well as nutritionist. So for that information, that comes up as the ILS, the Independent Living System. It's part of a Humana benefit that you're eligible for nutritional counseling sessions, and that's in all regions, and I can give you that contact information.
Yeah, they didn't help me when I called them.
The only other what I would recommend is speaking to your primary care physician to see what type of referrals or information they have. But for what I have as resources is going through Independent Living Systems, which is ILS. I can still share that information with you, the contact information and fax information, but it requires a PC referral. Would you still like that, Mr. Fawad?
No, I have the information. I called them already.
Oh, okay. Okay.
They didn't help me.
All right. So let me take that off of there, and I'll make a notation. All right. So we've sent you the ortho, ENT, neurologist, vision. And then you said the nutritionist. You don't want that from the ILS. And when I pull that up, now is there another zip code or area that you'd like for me to check in that's nearby you? Another city?
Try.
Because right now this is.
Try 33065.
33065.
Yeah.
Okay, let me see here what comes up for registered dietitians and nutritionists. And you want the same criteria if and or female or Arabic speaking?
Yes.
Okay. I was able to find 3 females in that area. The only language would be Yiddish. That's not a language that you requested. So let me send this to you, okay?
What is it called?
The language that they speak is Yiddish.
What is that?
I'm not for sure. Let me see here.
That's for nutritionists?
Yeah, and registered dietitian, the zip code that you provided for Coconut Creek area in Boca Raton.
So is that the nutritionist or the dietitian?
They're both. I selected for both practices, the registered dietitian and nutritionist.
And it wasn't showing up when you searched it in Tallahassee?
No, it did not. When you gave me the different zip code to search in, that's what came up. And they're females. There's 3 nutritionists on this list and 1 registered dietitian. So let's see here. Yeah, the first one is the registered dietitian, and the last 2 on the list are nutritionists. Do you want both this incorporated this with both types of providers?
Yes.
Okay. And these are females, okay? And it looks like they also offer virtual care, audiovisual.
Sure.
Okay, and I'll make this registered dietitian and nutritionist when I put the cover page on for you, okay?
Mm-hmm.
Mm-hmm. Right, and this is also going to come in a do not reply at humana.com. If you don't see it in your inbox, check your junk or spam folder. And click on the PDF attachment within the email, okay?
Mm-hmm.
All right. That's coming to you now. All right, so that's all the lists. Let me change that.
So it says the nutritionist that they had for me previously was Dr. Phara, middle initial J, last name Taylor, and it says MS space RD. It says phone number 772-800-3014. The nutritionclinic.net at 10570 South US Highway 1, Port St. Lucie, Florida 34952.
Let's see if that one's still in network, okay? Let me just take a look.
Says I scheduled an appointment on April 27, 2022 at 11 a.m.
provider is still in network. Okay. I'll search by the name. CHARA.
P as in Peter. HARA.
And Gaylord, GAYLOR.
Last name TAYLOR. T as in.
Taylor. Taylor. Okay. Thank you. Let's see. What city was that, Mr. Phil?
It says Port St. Lucie.
Port St. Lucie? Okay. Let's see if that's Laura. One moment, sir. It does show that that provider is still in network with Humana as a registered dietitian. So Farrah Taylor is still in network with us.
Okay.
Would you like that information? Well, you already have that information for that provider.
Mm-hmm.
Okay, so that person is still in network with us. So you have the registered dietitians, you have the ENT, ortho, vision, the nutritionist information. All right, so, and those that I just recently said have all the cover pages, Mr. Fouad. If you have any other questions, we're here from 8 a.m. to 8 p.m. Eastern Standard Time, okay? Monday through Friday.
And what's your name again?
My name is Shauna, sir.
I thought you said your name is Lakeisha.
No, sir, and no. My name's not Lakeisha. It's Shauna. Shauna is short. Shauna is short for LaShauna.
Okay. I'm trying to think, is there any other doctor I need to go to? Oh, yeah. What doctor do I need to go to donate?
Oh, let me see here. Let me see here. Here with me a moment. If there are bear with me one moment. All right. No, I'm not seeing that. We do have that. I do not see that as an option for a provider.
I think it's called surrogacy or something like that.
Let's see here.
Or fertility or something.
Let's see here. Let's see. No, I'm not seeing that. I would advise that you speak with your PCP for that, because I'm not finding information for that.
Good.
All right. Again, and we're here from 8 a.m. to 8 p.m. Eastern Standard Time if you have any other questions, Monday through Friday, okay?
Mm-hmm.
All right. Well, thank you so much for allowing me to assist you, and thank you so much for your time, Mr. Ford.
Is there anything I could do for you?
No, sir. I appreciate your time and your patience with me, sir. Definitely do appreciate your time and patience. And thank you so much for calling our team, and I hope you have a good evening, sir, okay?
Mm-hmm.
All right. Bye-bye for now.
The time now is 4:42 p.m. Today is Monday, July 15th, 2024. The duration of this audio transcript is 5 hours, 11 minutes, and 36 seconds. Assalamu alaikum wa rahmatullahi wa barakatuh.